The respiratory system, one of the major systems of the human body that is exposed to numerous and killer diseases that have rapidly been growing over the past decades. But thanks to technology, rates have decreased, yet many have been killed. Lung cancer is the leading cause of cancer deaths throughout the world among both men and women, and it claims to take away more lives compared to any other type of cancer. Cigarette smoking is the major cause of lung cancer, 90% in men and 70% in women. And this percentage is growing rapidly as the population grows. Where once a fashion, now it is a killing factor. There are other factors that lead to lung cancer, such as ionizing radiation as well as genetic factors. Smoking destroys the cilia in the airways, which depletes the removal of dirt, including tar from cigarette smoke, which in turn damages the tissues of the lungs. With every puff taken in, more tar is deposited, blackening the lungs. Lung cancer is the uncontrolled growth of abnormal cells starting off in one or both the lungs, usually in the cells that line the air passages. There are two types of lung cancers: small cell lung cancer and non-small cell lung cancer, by which there are certain different stages for each type of lung cancer. Another respiratory disease is laryngitis, which is an inflammation of the larynx, which typically results in a husky voice, a hoarse voice, or even the loss of the voice, as well as harsh breathing and painful coughs. Laryngitis may be short-lived, which is acute laryngitis, or long-lasting, which is chronic laryngitis. Another inflammation-based disease with the respiratory system is pneumonia, which is caused by bacterial or viral infection in which the air sacs fill with pus and may become solid. Inflammation may affect one lung or even both the lungs. Bronchitis, an inflammation of the lining and mucous membranes of your bronchial tubes, which carry air to and from your lungs. It causes bronchospasm as a result, which is basically the narrowing of the bronchi, and it also causes coughing that gives out very thickened mucus which can be discolored. Emphysema, a chronic lung disease by which the alveoli, as in the tiny air sacs in the lungs where exchange of oxygen and carbon dioxide takes place, are damaged, which means that the air becomes trapped. This causes the alveoli to expand and rupture, leading to breathlessness. COPD, which stands for chronic obstructive pulmonary disease, is the leading cause of death worldwide. It is not a single disease, but is an umbrella term that refers to chronic lung disorders that overall cause limitations in the airflow in the lung. Influenza is a highly contagious viral disease of global scope, which causes high fever, severe aching, and catarrh, and often occurring in epidemics. Asthma, another condition of disease in the respiratory system, by which your airways narrow and swell and produce extra mucus. As a result, it triggers coughing, wheezing, and shortness of breath. And finally, we have tuberculosis, a highly contagious bacterial infection caused by Mycobacterium tuberculosis. It is characterized by the growth of nodules, also known as tubercles, which are basically tiny lumps in the tissues, especially the lungs.